Judy Didion. She's the Dean of the School of Nursing for Oakland University. Great to have you with us.
Well, thank you, Ronnie.
So I was
Happy to be
online
here.
reading the poll that you all sent over that for the 19th straight year, nursing has ranked the number one most honest and ethical profession. Journalism was like 28 on the list, but we won't talk about that. But it really goes into, and I think the pandemic has really brought a shining light on the importance of your profession.
Yeah, yes, it has, and I'm very proud to see that poll this year again, but especially because of this year, it has been a really tough time for nurses, and they have just done everything possible to make the best they can out of this situation, and certainly what they're doing to provide patient care and deliver that and in the most effective and best way possible within the confines of personal protective equipment and being the conduit for the family has been very, very important as they take care of their patients because the family can't be there.
It's like that front line.
I
They really
know.
are the front lines because a lot of times doctors may come and go, but it's the nurses that are really spending more time with the patients, but their families as well.
Oh, yes, yes. And I know of a nurse who, had to use his own devices, his own cell phone to be able to help that patient communicate to the family because there was no way for the family to be at the bedside. And I think we've learned a lot about COVID, and it's still distancing the patient from their family when they need them most. And certainly with healthcare, with the new, some of the new interventions, they've been able to take care of those patients in a much more effective way. We've had more access to protective equipment for the nurses to reduce their exposure and chance of infection. And of course, with the vaccine, that's going to be a lifesaver for those healthcare providers. But nurses certainly used a lot of their critical thinking, I guess I would call it, because they had to be innovative. They had not faced an epidemic or pandemic like this before in their careers, and to try to figure out the best way to care for these patients when we didn't have the medical science in place because of it was such a new infection in our society and globally. So we saw nurses do all kinds of creative things to help these patients be comfortable, breathe better, get care quicker. So they certainly did stand up and rise up, I think I would call it, in this call for help.
So nearly 11 months into the crisis, and for some of the nurses, it must feel like this is never going to end. How do you take that and translate that to the next generation of nursing students?
Well, I think they experienced a lot of stress in this whole pandemic also because when we initially when there was the lockdown in March, it also created a lockdown for our students. Our students not only did they have to leave the classroom and start to learn remotely, there we have clinical education that goes on and lab education. So the students all of a sudden couldn't have that opportunity because the hospitals needed to focus on the patient and they couldn't have the students in there and feel like they could safely protect them. So initially our students, we had to figure out how can we teach our students about patient care when they're not at the bedside. So we've done all kinds of virtual things. It's amazing how many products came out, but also how our faculty had to rise up and think about how can we share experiences virtually so our students can continue to learn because we had the other end of the spectrum where the hospitals were struggling and needed the workforce. So we couldn't shut down nursing education. We needed to provide our students the education so they could continue to progress. So those first couple months were kind of tough, but then as the hospitals opened up more, our students have gotten back into the acute care settings and they've had the experiences. It's not quite 100%, but we're slowly getting there. What was surprising to me is how energizing this was for our students, because they saw those nurses in practice and they were inspired. They weren't afraid. I was afraid myself that we would lose students, or students wouldn't want to come into the profession because they would see that it's not risk-free. And it's never been risk-free, because any healthcare provider comes in contact with infectious disease all the time. But this was so real. So what we've seen, though, is the complete opposite. Our students have just been dying to get back into the healthcare settings and take care of those patients, because they see themselves as someone that can provide the care that those patients need and make a difference in how that care is provided. And I also see new students coming in. I didn't want to interrupt you, but we
No, I was going to say, for the new students coming in, they're not turned away. They want to be a part of the solution then.
Our enrollment has not dropped. We still have more students wanting to be nurses than we have space in our clinical and classroom. Yes, they really are energized and want to be part of this. They see this profession in a whole different light. I think they actually see it in a more realistic light, because a lot of times students want to be a nurse because they watch TV and they think that's what it's going to be. But this has been real. This has been real. Every single day you see nurses who have sad stories and wonderful stories about what has happened to nurses during this pandemic. And our students have been inspired by that. So they are very excited to be part of the profession.
So as you just mentioned, more and more students do want to go into nursing, but even prior to the pandemic, nursing school is not easy to get into. It's very competitive.
Yes, it is.
What advice do you give to maybe high school seniors or, freshman students about their path into this world?
Well, I always say to the students that are interested in nursing, think about how it's based on hard science. You really need to study. You really need to appreciate, as you move through the sciences, that this is information you're going to have to continue to, keep in your mind. It's not a course that you take and just check off and throw out. You need to know the anatomy, the pathophysiology, the chemistry, because that's what nursing is built on. So for high school students, especially, I think it's important for them to think about nursing, maybe do some shadowing in one of the hospitals to see what nurses really do, so that they understand that, yes, we are very, very intimate with human beings. We have to touch people. We have to be present when they're in the most miserable time of their lives. Anyone who's feeling ill is very, not the most pleasant person to be around, and why would we expect them to? So I try to let them think about how the realism of nursing, but then also it's time to prepare for nursing education when you're in high school. Think about the courses you're taking, the college prep, the sciences, and study hard. And then when you get into our freshman year at the university, you have to be disciplined, because you have to make the grades to get into the program. So they may not have the same social life sometimes as some of their friends, but it is important to make those grades because it's competitive. And a lot of people ask me, well, why don't you just take everyone? And we would if we could, but what happens is that our clinical resources, students spend a lot of time taking care of individuals outside of, in the hospital or in the community. And those agencies can only take so much, so many students. So that's why it restricts our enrollment in that respect. But I'm just happy they want to come.
Right, because we need them. Judy Didion with us here. She's the Dean of School of Nursing for Oakland University. And Judy, when it comes to the students, and you had mentioned job shadowing, so many entities have closed down their job shadowing programs or their internship programs. And while nurses are on the front line, is that still the case in the world of nursing with these programs?
Well, many of the hospitals do have programs, especially in the slower months. Now, we haven't had many slow months recently, but in the summers, where they will bring in high school students and allow them to spend a day with a nurse. We also have at Oakland, we call it Camp RN, and we run it every summer. And it's for junior high students that are thinking about going into nursing or a health profession. And it's in that camp that we actually arrange for some shadowing, as well as letting them come to our lab and see what it's like to go through simulations and work with some of the equipment. So I think the organizations, healthcare organizations, know that they have to invest in the future of the workforce, because we're at a time where many, many nurses are nearing retirement, and we don't want to have a shortage in the future. So we work very closely with the healthcare partners, which would be all of the health systems in the greater Detroit area, to not only place our students for their clinical education, but also to work with programs that they might be able to help us inspire young men and women in high school or junior high to think about nursing as a profession.
How do you think the pandemic is going to change the world of nursing and the profession of nursing long term?
Well, I think we'll always need nurses. I think what will change is how healthcare is delivered. We know now that telehealth has become booming. You know, it was something some people were doing, but now everyone has to do it. So as far as the nurse's role in that, many times they are the ones that might go into the home using the telehealth equipment and doing the assessment and sending that information back to the healthcare provider. But they also help the patient who is on self-monitoring devices understand what that information means. So if they're checking their weight or their blood pressure, their blood sugar, it's the nurses that often do that patient education to help them know when to call their healthcare provider or how to manage that information. In hospital systems, we're also seeing telehealth between hospitals. So many of the rural hospitals are using telehealth towards the intensive care units in some of the major metropolitan areas to work with nurses, working with nurses to help them manage their patients, because in rural hospitals, you may not see the variety every day. So you need to have resources at your fingertips. So I think healthcare will change on how people manage their health, how people manage chronic illnesses. We'll still have critical care and acute care in the hospital systems. We may have more technology to help us monitor and identify earlier, when patients are turning a corner, not to the best, but so technology has been very helpful, but someone has to think about what that technology means and then provide the human care that's so important. So nurses will still be at the bedside because we're working with human beings that need that comfort, that need that reassurance, and that hope that they're going to recover and get out of that hospital and be back with their family. So that's where I see us moving toward.
Well, there's really just another minute left here with you here on the MegaCast. And like you said, they very much are needed on the front lines. Any advice do you have any advice for someone thinking about going into nursing or maybe making a career change right now?
Oh, I think if that's what you're interested in and you really want to do, it's a wonderful, wonderful profession. I think, it's not just that there's lots of jobs. Yes, there's lots of jobs. We'll have a job, but those jobs are not easy. So you have to have the passion and the love to be effective in those jobs. And the nice thing about nursing is that there's so much variety out there. You could spend some of your life in the hospital, some of your life in the community, public health, education, research. There's so many aspects of nursing that you can never be bored. That's for sure. And I think when I talk to my colleagues and friends, we've all had a wonderful career in nursing, no matter where we've been. But in terms of our career, longevity or ladder. But it is a wonderful profession. But you really need to be passionate because it requires so much of you to be effective in that profession because of the work you do.
Well, I would think just like for the students, it's been a stressful time during the pandemic, but also for people such as yourself and having to adjust to teach during these times as well,
Oh,
because
yes.
it's hard for them. They have to hit the ground running when they get into the hospital. So we thank you for your time and your passion for the next generation of nurses. Judy Didion with us. She's the Dean of the School of Nursing for Oakland University.